we had ended at what are the points to look for while interpreting an ECG. Okay, a patient is coming to your clinic with a strip of ECG strip, and you want to interpret whether it is normal ECG or having any kind of issues, right. So, you have 10 points or 9 points, actually 9 points you need to look for with the ECG, right. So, first is the rate, okay. First is the rate, second is the rhythm, then axis, rate, rhythm, axis, okay. We call it the rate, rhythm, axis, right. Then P wave, then PR interval, then QRS complex, okay, QRS complex, next ST segment, then T wave, and finally QT interval, okay, finally QT interval, and finally your comment, right, okay. So, even before that, we need to look for another thing, that is the validity of the ECG. What is called the validity of the ECG? Okay. So, during your practical session on ECG, we will learn where to put the ECG leads. Okay. So, by now you already know that we connect right arm, left arm, it is lead 1, okay. It is lead 2, okay, and it is lead 3, right. You know the direction of the leads, okay. But with the machine, how to do that? The machine has some conventional clips. We need to attach those clips to the patients, right. So, these things we will do in practical classes, but for now remember there is a red clip that we apply on right arm, okay. There is an yellow clip we apply on left, right. So, remember in this way, red for right, okay, red for right, and on your right leg we put the black clip and the green clip on left foot, right. Okay, now one question may arise in your mind, that we are connecting, say for example lead 1, we are constructing lead 1, so right arm and left arm, okay. Now there is a clip, like, okay, so clip we can apply everywhere, okay. So, one question you might ask, that should I apply the clip over here or here or here, okay, whether it is on the arm, on the shoulder directly, or it is on the arm, on forearm, on wrist, okay. So, you can apply anywhere, because your body is a volume conductor, right, your body is a volume conductor. So, but traditionally or conventionally we apply on the wrist, okay, we apply the clip on the wrist, and chest leads are easy, okay, chest leads are easy because you apply directly on the chest wall, and there are specific positions of the chest leads that you need to remember, okay. Okay. So, in anatomy, what is going on right now? Is it abdomen or thorax or superior extremity or what? Superior extremity. Okay, okay. So, it is superior extremity, right? Okay. Thorax you still don't know, right? Okay. Okay. The position of the ECG leads I will tell right now, but you will apply the ECG leads right in your practical classes, right? Okay. So, to recap, there is a right clip, there is a red color clip which we apply on right wrist, okay, red for right. There is an yellow clip of the machine we apply on left wrist. There is a black clip we apply on right leg, okay, right leg just above the medial malleolus, okay, and there is a green clip we apply on left foot, okay. So, these are the conventional color coding and conventional attachment of the clip, okay. So, on my right wrist there is red clip and on my left wrist there is yellow clip. So, these two constitutes lead 1, okay. So, it measures potential difference between RA and LA, okay. Okay. So, while defining a lead, I have told that lead is a pair of electrode, right. Lead is a pair of electrode and in between there is a voltmeter which measures potential difference between the 2 points. Okay. Now comes the question for chest leads. Okay. So, chest leads V1 to V6, okay, V1 to V6 এগুলো অ্যাকচুয়ালি দেখলে ভালো মনে থাকবে, যাই হোক আমরা এখন বলছি আবার প্র্যাকটিক্যালি আবার করব, রাইট। ওকে, V1 is located at right second intercostal space just lateral to sternum, okay, right second intercostal space just lateral to sternum. You know what is sternum? Okay, this bone is sternum, okay, and the ribs are in this way, okay. So, just below the clavicle, you know clavicle, what is clavicle? Yes, okay. So, just below the clavicle you get space, okay, these are intercostal space. So, you need to come to second intercostal space, okay, you need to come to second intercostal space, first space, second space, in this way you need to come to second intercostal space, just below the clavicle you will get the second space, okay. So, second intercostal space right side just lateral to sternum is your V1, okay. So, here is a sternum, okay, and here are the ribs, right. So, second intercostal space, this is the position of right side, on right side it is V1, right, V1, this is sternum, second intercostal space is the location of V1, okay, right side, left side same position, left second intercostal space V2, right. We do not put V3 immediately, okay. So, if this is the clavicle, right. So, on mid-clavicular line, okay, mid-clavicular line we get V4 and between V4 and V2 we get V3, right. Okay. Then V5 on anterior axillary line, okay, on anterior axillary line, fifth intercostal space, and V6 is mid axillary line, okay, mid axillary line, fifth intercostal space, okay. So, I need to demonstrate it 3-dimensionally, okay. So, if you look at me or if you feel your own, this is your sternal notch, right, this is your sternal notch, okay, sternal notch, everyone getting your sternal notch, this is the sternal notch, the concavity, right, okay. From sternal notch you come down and you get a bony prominence, okay, you get a bony prominence, and from this bony prominence if you shift left or right, okay, you get a space, that space is second intercostal space, okay, that space is second intercostal space. So, in second intercostal space on right side we put V1, okay, and same position on the left side we put V2, right. Now, V1 and V2 is done. Now, this is clavicle, this is my clavicle, and in the mid-clavicular line, fifth intercostal space you get V4, right, V4, and in between V4 and V2 we put V3, right. Now, this is anterior axillary line, this is anterior axillary line, this is mid axillary line, this is posterior axillary line, because your body torso is rotating in this way, right, okay. So, in anterior axillary line we put V4, right, mid-clavicular line we put V4, anterior axillary line V5 and mid-axillary line V6. Okay. We will again practice this during our practical session. Okay. Now tell me, I am putting the right clip on my right side and red clip on right side and yellow clip on left side. So, the potential difference between right and red and yellow, this is your lead 1. So, that is essentially a lead is measuring potential difference between 2 points. Now, what about V1? V1 is a chest lead. Okay. So, V1 is supposed to measure potential difference between which 2 points? My question is as simple as that. Anyone? A lead is always a thing which measures potential difference between 2 points. Okay? A lead measures potential difference between 2 points. So, in case of lead 1, it measures potential difference between right arm and left arm. What about lead V1? It is also a lead, but we are putting only one clip on lead 1. Okay. So, it is measuring potential difference between which 2 points? One point is definitely the position of the V1, the right second intercostal space immediately lateral to sternum. So, where is the another point? Is my question clear to you? Okay. कोई भी लीड ले लो, ECG का कोई भी लीड ले लो, it measures potential difference between 2 points. So, in case of lead 1, it measures potential difference between your right arm and left arm, right? In lead 2, it measures potential difference between right arm and left foot. Okay. And similarly, lead 3, it measures potential difference between left arm and left foot. What about this lead V1, V2, V3, V6? V1 measures potential difference between which 2 points? One point is definitely the position of V1. Where is the another point located? Answer is, all these chest leads, they measure potential difference between the point where the lead is attached and another point which is located within the machine, within the ECG machine, which is the neutral point. Okay. So, V1 measures potential difference between neutral and this point, right. V2 measures potential difference between neutral and this point, left second intercostal space. Okay. V4 measures potential difference between neutral and on mid axillary line, fifth intercostal space, right, clear. So, we are calling these chest leads as unipolar leads, unipolar lead, but this unipolar lead, this term is a misnomer. A lead cannot be unipolar, it always measures potential difference between 2 points. So, a lead must be bipolar. To satisfy the definition of lead, a lead must be bipolar. There is nothing called unipolar lead, but conventionally chest leads V1 to V6, these are called unipolar leads. Excuse me. So, very often a question is asked during your viva examination, why chest leads are called unipolar leads? So, first you need to tell in answer that this is a misnomer. Okay. Leads are not unipolar. Okay. This is a misnomer. By the definition of lead, a lead is a pair of electrode which measure potential difference between 2 points. So, lead must be bipolar, right. In case of chest leads, it measures potential difference between the point where the lead is attached and another point which is located in the machine called the neutral point, right. Okay. So, after ECG lead placement, now we will focus on the graph. Okay. We will focus on the graph. So, ECG is definitely located on a graph paper, right, on a graph paper. It has got, it is a two-dimensional picture, your ECG is a two-dimensional picture, right. It has got an x-axis and y-axis. What does x-axis and y-axis mean? Tell me. X-axis is time, very good. X-axis is time and y-axis is voltage, same as that of action potential, okay, same as that of action potential. Take it any action potential, it may be neuronal action potential, it may be action potential of the skeletal muscle or the cardiac muscle, right, or the SA nodal action potential. In the x-axis we measure time, in y-axis we measure voltage, okay. In x-axis we measure time in unit of millisecond and in y-axis we measure voltage in millivolt, okay. Okay. So, conventionally all ECG machines are same throughout the world, okay. Wherever you go to US, you go to Europe, you go to Africa, right, wherever you go you will find the ECG leads are conventional. There will be red color clip, yellow color clip, black color clip, green color clip and the chest leads, okay. And on the chest leads it is written as V1, where to put V1, V2, V3, V4, V5 and V6, right, it is conventional, okay. And this graph paper, it is also conventional, okay, graph paper is also conventional. So, in the graph you see, first do not look at the ECG curve, just look at the graph. So, you have a big square, okay, you have a big square, right, and you have small square, right. Each big square contains 25 small squares, right. Each big square or large square contains 25 small squares, clear, okay. In x-axis, one small square is equal to 0.04 second, that equals to 40 millisecond, right. I repeat, in ECG axis you have x-axis and y-axis. Along the x-axis we measure time in the unit of millisecond and in y-axis we measure voltage in the unit of millivolt, right. Okay. So, if I ask you one large square, okay, one large square is equal to how much time in x-axis? Yes? 0.04, 0.04, 0.04, 0.04, 0.04. 2 0.04 into 5, okay, কত হয়? In seconds bolo, in seconds, 0.04 second, okay, 0.04 second, okay, 0.04 second into 5, that is 0.2 second, 0.2 second, right, okay. তাহলে এই স্মল ঘরগুলো দিয়ে we can measure the duration of any wave, okay. Now, if I ask you, tell me the duration of T wave, tell me the duration of T wave, can you tell me? Okay, first you need to look how many small squares are there at the base of T wave. Yes, so 1, 2, 3, 4. There are 4 small squares at the base of T wave. Okay. Now, what is the baseline? Baseline is this. This is the baseline, right? This is the baseline of the ECG. Okay. This is the baseline of the ECG. Baseline means where there is no net voltage fluctuation. Okay, we also call it isoelectric line. Okay, we call it isoelectric line where there is no net voltage fluctuation. Correct. So in ECG, this is what wave? P wave. This is Q. This is, and this one is T, and this is also U. Okay, U wave is rare to see, we will discuss later on. Okay. So, is there any isoelectric line in the ECG, within the ECG after starting of P wave? P wave start howar pore kono isoelectric line ache? Yes, this one is isoelectric line. Okay, so that essentially means after starting of P wave shuru hone ke baad and ventricular complex, that is QRS complex shuru hone se pehle, there is an isoelectric line. That means during that time there is no net voltage fluctuation. Okay, I told why P wave is generated. P wave is generated because of atrial depolarization. QRS complex is due to ventricular depolarization. Okay, and P wave is due to ventricular repolarization, right? Okay, so between atrial depolarization and ventricular depolarization, there is an isoelectric line. During this time, there is no net, flow of electricity. No net flow of electricity, right? Okay. তার মানে এই ডিউরেশনটাতে কোনো ইলেকট্রিসিটি ফ্লো হচ্ছে না অ্যাপারেন্টলি, অর হচ্ছে একটাকে ক্যান্সেল করে দিচ্ছে, রাইট? ওকে, সো নো নেট ফ্লো অফ ইলেকট্রিসিটি ডিউরিং দিস টাইম. Okay, we have another isoelectric line in a normal ECG. Where is it? Okay, after completion of S and the beginning of T, in between we have another isoelectric line. This isoelectric line is called ST segment. Okay, and ST segment should be isoelectric. Okay, ST segment should be isoelectric. Do you know why ST segment is isoelectric? Eta to is your atria is depolarized, tarpore ventricle depolarized hobe, but in between there is no net electricity flow, right? In between there is a gap. Okay, but eita ventricle depolarized hoye geche, now repolarize hobe. Okay, T wave is repolarization, right? So during this time there is no net electricity flow. Why? Do you remember the action potential in cardiac myocytes? Cardiac myocytes. Do you remember the action potential, the shape of action potential? Yes. The shape of action potential was this. Remember? This is phase 4, this is phase 0, phase 1, phase 2, phase 3, again phase 4, right? So what was happening during phase 2? Phase 2 is a Plateau phase where there is no net voltage change. Okay, this phase 2 was happening because of calcium entry and potassium efflux, and they were balancing each other. Okay, positive ion entry into the cell, positive ion exit out of the cell, right? So these two things were balancing each other, and during this time there is no net electricity flow, and this phase, more or less phase 2, coincides with ST segment. Clear? So a question may be asked, why ST segment is isoelectric? Okay, then you need to tell that in cardiac myocytes, phase 2 action potential is isoelectric because of calcium entry and potassium exit. Okay, and the collective action potential that gives rise to ECG wave, in the ECG wave, phase 2 corresponds to ST segment. That is why it is isoelectric. Clear? Okay. Now, if I ask you ST segment, what is the time duration of ST segment? Can you tell me? It is almost 3 small square. 1 small square in x axis equals to 0.04 second. So, 0.04 into 3. So, ST segment, length of ST segment is 0.12 second. Okay. Now, tell me what is PR interval? What is PR interval and what does it signify? Yes. Now, that is correct, that is definitely correct. Okay, depolarization wave, it is travelling from atria to ventricle and the time duration it takes is the PR interval, PR interval. Okay. In ECG, PR interval is, do you know what is PR interval? PR interval is from the start of P, okay, this point, from the start of P to the beginning of QRS complex. So, that is essentially beginning of Q, from the beginning of P to beginning of Q. It is not PQ interval, it is PR interval, okay, remember, right. So, whenever your examiner is asking you what is PR interval, your answer should be from the beginning of P to the beginning of Q, okay. But still we do not call it PQ interval, it is PR interval, right. So, why do we need to measure PR interval? PR interval keno mapbo? What is its clinical significance? Achha, before that tell me PR interval in time. Okay. So, 1 small square, 2 small square, 3 small square and 4, right. Ekhaneo ekটু gap ache, so we can consider 4, right. So, more or less 4 small square, okay. Actually, in an ECG we do not need to measure it because nowadays ECGs are computerized, so your software will measure, ঠিক আছে। আমরা কতটা মাপছি, আমরা একটা স্কয়ারের পুরোটা হলে বুঝতে পারছি, একটা স্কয়ারের যদি অর্ধেকটা হয় তারও কম হয় তখন তো আমরা ক্যালকুলেট করতে পারবো না। সো কম্পিউটার ক্যান মেজার, ওকে। সো 1 small square is 0.04 second, half small square is 0.02 second, okay. उससे भी ज़्यादा फ्रैक्शन हो जाएगा तो it's not possible, right, okay. But the machine can measure, okay. But as we are learning, we need to do it manually, right. To learn, you need to do everything manually, and in your exam also you need to manually calculate, right. Okay, even if it is computerized ECGs, those measurements, PR interval, ST segment, okay, those measurement will be covered. You need to manually measure, right? Otherwise, you won't learn. Okay. So, what is PR interval in time? 0.16. Okay, 4 small squares. So, 4 into 0.04, that is 0.16 second. Okay. So, that essentially means atrial depolarization wave or the action potential, it takes 0.16 second time to reach from atria to ventricle, okay, because P wave is atrial depolarization, QRS complex is ventricular depolarization. So, the time gap between atrial depolarization and ventricular depolarization, okay. So, the time duration from atrial depolarization to ventricular depolarization is PR interval, okay. So, why this 0.16 second is required? Why not immediately after P wave it is QRS complex? Once atria is depolarized, now next thing is ventricle is to be depolarized, right. Now, atrial depolarization can travel to ventricle by a path. Which path is this? You remember the conducting pathways? SA node to AV node to bundle of His, then it divides right bundle branch, left bundle branch again divides into anterior fascicle and posterior fascicle, right? Okay. So, there is a checkpoint, okay. So, there is there is police to check. So, police is located at which point? AV node. AV node is the checkpoint. Okay. AV node is the checkpoint. It will check the waves coming from above, matlab atria. Okay. So, here is AV node. It will check the wave coming from atria. If it is normal, then only allow. Okay. Then only allow to the ventricle, because ventricle is a sophisticated structure, right. We should not allow abnormal waves moving into the ventricle, right. So, police is there at AV node. It will check the atrial wave coming at the junction. Junction means AV node. Okay. It will check the atrial waves whether the wave is correct or not, right. Many a times there are abnormal waves coming from atria. Okay. Many abnormal action potential coming from different locations of the atria may come. So, AV node will check that, AV node will block that. Okay. So, the police will allow the normal traffic, but not the traffic which is smuggling, right. So, this is the function of AV node, just like a policeman. Okay. This checking process, it takes some time, right. Okay. So, this is why there is existence of PR interval. Okay. And many times there is abnormality in the checkpoint as well. Okay. The abnormality may be in such way that abnormal waves coming from the atria are passing into the ventricle without checking, it may happen, or it may also happen that even the normal wave, it is not coming to the ventricle, it can also happen. Okay. If abnormal waves are passing unchecked through the AV node into the ventricle, it will give rise to arrhythmia, right. It will give rise to arrhythmia, and the patient will be having complaints like palpitation, right. And what will happen if the normal wave is also not coming into the ventricle from atria to ventricle? Okay. It will create heart block, right. Anyway, we will take separate class on heart blocks. Okay. So, PR interval in this case, in this patient, ECG jiska bhi hai, right. So, PR interval in this ECG is 0.16 second, which is normal, because the normal range of PR interval is 0.12 to 0.2 second. Okay. 0.12 to 0.2. This is normal PR interval. Okay. So, इसका मतलब simple, from 3 small squares to 5 small squares, right. So, in PR interval there must be 3 to 5 small squares. Okay. If less than 3 small squares means 0.12 second, clear, 0.04 into 3, okay, and 0.2 second means 5 small squares. Okay. So, PR interval is essentially 3 to 5 small squares. If it is less than 3 small square, we will call it short PR interval. Okay. Matlab waves coming faster than what it is supposed to, right. And when PR interval is more than 0.2 second, that means more than 5 small square, we call it long PR interval. Clear? Okay. Now, the duration of QRS complex, duration of QRS complex. QRS complex means from the beginning of Q to the end of S is the duration of QRS complex. Okay. So, here 1 small square, 2 small square and 3, right. এখানে কিছুটা কম আছে, এখানে কিছুটা বেশি, so makeup হয়ে গেল 3টে small square, right. Okay. So, 3 small squares. So, duration of QRS complex is Duration of QRS complex is 0.12 second. Okay. 0.12 second essentially means 120 millisecond. Okay. 120 millisecond, right? Okay. And QRS complex when less than 120 millisecond or up to 120 millisecond, we call it narrow complex. Okay. And when QRS complex is more than 120 millisecond, we call it wide complex. Okay. And definitely wide complex is an abnormality. Okay. When QRS complex is more than 120 millisecond, we call it wide complex ECG. Okay. Wide complex ECG, and wide complex ECG is abnormal, right. Normal QRS complex should be less than 120 millisecond. That means less than 3 small squares. Clear? In a computerized ECG, everything will be written. We can calculate 120 millisecond, 80 millisecond, but in a computerized ECG, the computer can also calculate 119 millisecond, 117 millisecond. That is impossible to calculate manually, right. So, you will get the exact QRS duration from the software of the computerized ECG, right. Okay, we will show this in your practical classes. Okay. Now, we will focus on the y-axis. Just like in x-axis, one small square in the x-axis equals to 0.04 second, in y-axis one small square equals to, yes, 0.1 millivolt, okay, 0.1 millivolt, right. Now, if I ask you what is the voltage of P wave? Yes, 0.2 millivolt if it is 2 small squares. Okay, if this is 2 small squares, okay, it is somehow around 1.5 and 1.75 something like that anyway. So, if we consider it 2 small squares in height, so it is 0.2 millivolt because 1 small square is equal to 0.1 millivolt. Okay. Now, if I ask you what is the voltage of QRS complex? No, before that first tell me what is the voltage of R wave? What is the voltage of R wave? So, whenever I am asking you to calculate voltage of a particular wave, you need to calculate from the baseline. Okay. So, here is the baseline. Okay, here is the baseline. This is baseline, clear? This is baseline. So, this is baseline. So, from the top, if you take it as a complete square, it is not complete yet, although it is not complete. So, 1, 2, 3, 4, 5, 6, 7, 8, 9 and 9.5. Okay. So, consider it 10. Okay. Suppose it is 10 small squares. So, that means 1 millivolt. Voltage of R wave is 1 millivolt, 0.1 into 10. Okay. 0.1 into 10. Okay. Now, net QRS voltage. Net QRS voltage. What is net QRS voltage? Net QRS voltage is combined Q, R and S. So, if we consider R wave is plus 10, okay, R wave plus 10, Q wave minus 1 and S wave minus 2. Say for example minus 2. यहाँ पर कितना है? 2.5 minus 2.5. Okay, anyway, consider it minus 3, right? Assume it is minus 3. So, this is minus 1, this is minus 3 and this is plus 10. So, what is net QRS voltage? Plus 6. Okay. So, if I ask you what is net QRS voltage? Okay. So, your answer should be calculating all the waves in the upward direction and downward direction. Okay. positive, negative, and you get the net QRS voltage. Okay, why net QRS voltage is important to measure? Tell me when QRS voltage will be higher, more positive. এটা অনেক লম্বা হলো, সে ফর এক্সাম্পল QRS কমপ্লেক্সটা এতটা বড়, ঠিক আছে, অনেকটা বড়, সে এখানে কটা আছে, 10 স্মল স্কোয়ারস আছে, সে ফর এক্সাম্পল ইট ইজ 30 স্মল স্কোয়ারস। কেন হতে পারে? ইট ইজ নর্মাল, 10 স্মল স্কোয়ারস বিং নর্মাল, রাইট? কেন হতে পারে? What is the problem with the patient? Either the patient is very thin built, number one, okay, either the patient is very thin built or heart is quite superficial, okay, just একটু নিচেই হার্ট আছে, ওকে। আর QRS ভোল্টেজ কখন, ফিজিওলজিক্যালি QRS ভোল্টেজ কখন কমে যাবে? when the patient is obese, okay, when the patient is obese, okay. So skin, different layers of skin, then subcutaneous fat, then at the depth there is heart, right? So voltage will be less, okay. And when the patient is very thin built, khub roga patla, then QRS voltage will be high. So this is normal, there is no problem with it. Someone may be thin built or someone may be obese, right? But the problem is when QRS voltage will be higher or low due to some abnormality, like say for example in a case of hypothyroid, okay, in a case of hypothyroid patient, QRS voltage will be low, okay, QRS voltage will be low. And the opposite is also true, in a case of hyperthyroid, QRS voltage will be higher, right? There are other examples as well. We talked about ventricular hypertrophy, when your left ventricle or right ventricle is getting hypertrophied, okay, muscle mass is more, again this voltage will be higher, right? Clear? So what are the causes? The question may comes in this way, what are the causes, or tell me one or two causes, okay, one or two causes of high voltage ECG and one or two causes of low voltage ECG. High voltage ECG causes are thin built patient, hyperthyroidism, ventricular hypertrophy, right? Low voltage ECG examples are hypothyroidism, okay, obese patient, right? Clear? So these things are to be kept in mind, okay. So we have discussed the graphs, right? What in the x-axis and what in the y-axis, okay. Now next we will discuss axis, okay. Normal axis is located in which region? What is the range of normal ECG axis? minus 32 plus 110, minus 32 plus 110, okay, minus 32 plus 110, okay. So here it is 0 degree, right? It is 0 degree. Here is your lead 1 at 0 degree. Here is lead 2 which is at 60 degree. Here is lead 3 which is at plus 120 degree, right? This is lead AVF plus 90 degree. This is lead AVL minus 60. This is AVR, কত ডিগ্রি? Clear? Now your mean electrical axis is located within this region. Okay, this is the location of mean electrical axis. You remember? You remember or forgot about ECG axis? What is ECG axis? What is ECG axis or mean electrical vector? ECG axis is same as that of mean electrical vector. You remember or forgot? You remember what is mean electrical axis? Yes, it is the combination of all the vectors, okay. It is the combination of all ventricular vectors particularly, okay, 2, 3, 4, 5. It is the combination or the resultant of all the ventricular vectors, right. This is ECG axis, and in a normal healthy individual, it must be within this range, minus 30 degree to plus 110 degree, okay. তাহলে ECG axis এর মধ্যেই থাকবে, এদিকে গেলে left axis deviation, এদিকে গেলে right axis deviation, okay. Okay. Now, a big question in your first professional MBBS is calculate ECG axis, okay. So, there is a way to calculate ECG axis from the ECG, okay. একটা ECG দেখে আমরা ECG axis calculate করতে পারি, right. From any ECG we can calculate ECG axis, okay. তাহলে একটা ECG পেলে আমাকে যদি axis calculate করতে হয় তো কিভাবে করব, okay. So, there are multiple ways, and all the ways you need to understand, okay, because there is a mathematical way, number one. So, to calculate exact axis in the mathematical way, you need to have a scale, a pencil, a protractor, right, to measure the angle, right, okay. But will you do that once a patient coming with his or her ECG, and you are taking out a pencil, an eraser, a protractor, a scale, and drawing something for calculating ECG axis, and the patient is waiting? Will you do that? No, okay. So, just looking at the ECG, you need to comment whether the axis is normal, or there is left axis or right axis. But for your MBBS practical or examination purpose, you need to calculate the exact axis by means of a protractor, a scale, right, a pencil, right. So, you need to learn both. So, first is just by seeing an ECG whether the axis is normal or right axis or left axis or what, okay. This can be done. And second, you need to take pen and paper or pencil or paper, protractor, and draw and tell the exact axis, whether it is minus 30 degree or plus 90 degree or plus 65 degree or plus 70 degree or whatever, right, okay. So, for this, for immediate, the patient is giving you the ECG strip, and you need to comment whether the axis is normal or not. Don't tell the patient that it is you have left axis deviation, the patient will slap, right, okay, because the patient do not know what is left axis deviation, what is right axis deviation. But you need to interpret as fast as possible whether it is left axis deviation or right axis deviation, and you know what are the causes of left axis deviation. It is left anterior hemi-block, it is left ventricular hypertrophy, right. What is the cause of right axis deviation? It is right bundle branch block or right ventricular hypertrophy, right, okay. So, how to do that? Thumb rule of cardiac axis, okay. So, what is thumb rule of cardiac axis, okay. So, we will look at the ECG, right. So, I am looking at the ECG, right, everyone look at the ECG, okay. So, here is an ECG, we need to look at two leads, one is lead 1 and another is lead AVF, okay. So, this is lead 1, clear, this is lead AVF, clear, okay, okay. So, the thing is, take your two thumbs out, one is for lead 1, left is for lead 1 and right thumb is for lead AVF. So, look at lead 1, whether QRS complex is predominantly upward or predominantly downward, okay. So, lead 1 QRS complex is upward, right, lead AVR QRS complex is downward, lead V1 QRS complex is downward, okay. But all leads I do not need to see, I need to see lead 1 and lead AVF, right. So lead 1 QRS complex is upward, so left thumb up, clear, left thumb up. Lead AVF QRS complex is predominantly upward or downward, upward, so right thumb is also up, both thumbs up, axis is normal, right, clear. Another ECG, lead 1 up, lead AVF down, क्या करें, ये तो dislike button है ना, dislike, we don't go with the dislike, we go with the like. So which thumb is like? One, मतलब left thumb is like, okay, we will not do dislike, we don't dislike anyone, right, सबको like करते हैं हम लोग, right, okay. So lead 1 thumbs up, lead AVF thumbs down, we will not go with this, we will go with this. So left thumb up means left axis deviation, मतलब the patient is having left anterior hemi-block. This ECG is of a patient who is having left anterior hemi-block. Okay, we will discuss heart block later on. Just right now, just try to understand how to interpret ECG axis, right? Next, lead 1 ऊपर भी थोड़ा सा है, नीचे ज्यादा डाउन है, so predominantly downwards. Lead 1 is predominantly downward, so left thumb down, right thumb for AVF up. Okay, we will not go with the down, we will go with the up. So right thumb up, it is right axis deviation. This is right axis deviation, right? This ECG is right axis deviation. Okay, right axis deviation माने axis 110 এর বেশি আছে, আচ্ছা, আর লেফট অ্যাক্সিস ডিভিয়েশন মানে -30 এরও কম আছে, ঠিক আছে, -30 থেকে +110 এইটুকু হচ্ছে নরমাল অ্যাক্সিস, ঠিক আছে, এটাতে রাইট অ্যাক্সিস ডিভিয়েশন আছে মানে পেশেন্টের রাইট ভেন্ট্রিকুলার হাইপারট্রফি মেবি আছে, এবার সেটা আমাকে ইকো করে দেখতে হবে, বা দেয়ার উইল বি আদার সাইন্স অ্যান্ড সিমটমস অফ দ্য পেশেন্ট, উই নিড টু কোরিলেট, রাইট, ক্লিয়ার, ওকে। সো ইসিজি দেখে সবাই লেফট অ্যাক্সিস রাইট অ্যাক্সিস বলতে পারবে, ওকে, okay, so this is harder one because this is called northwest axis, okay, this is called northwest axis because both thumbs are down, okay, and this is extremely rare condition, perhaps you will never see an ECG in your practicing life, an ECG with northwest axis, okay, it is extremely rare, okay. In all common clinical cases you will see either left axis deviation or right axis deviation or normal axis, right, okay. This will not be asked, okay, this is PG level question, okay. So left axis deviation, right axis deviation immediately by seeing, okay. So with the thumb rule we can immediately tell whether it is the left axis deviation or right axis deviation with the thumb rule, but we can't comment about the exact axis. If someone is asking you, yes, it is right axis deviation, that means right axis deviation, that means it is beyond +110 degree, right, it is beyond +100 degree, but tell me how what is the exact axis, whether it is 120 degree or 130 degree, okay, tell me the exact axis, okay. So we will begin from this exact axis calculation from our next class, right, and that is a question in your first professional MBBS examination, okay, exact axis determination. There are also again two procedures, one is by drawing things and another is simply by calculating tan theta, okay, lead 1 and AVF का tan theta calculate करके 2/√3 tan theta एक formula है, right, so we will learn in our next class, right.